Good afternoon, everyone. This is Carle Falk with Notable, and welcome to the Becker's webinar titled Solving the Workforce Crisis: How Can Automation Boost Care Team and Patient Satisfaction? As I already said, I am Carle Falk, and I represent Notable, which is a health tech company devoted to bringing intelligent automation to the front end of the healthcare experience. We have automated patient intake and registration, care gap outreach, prior authorizations and copay collection, insurance card capture, scheduling, and much more. To date, our solutions have reached over 9 million patients who are served by thousands of providers across the country. As head of research, I drive thought leadership by surveying the full range of healthcare stakeholders, patients, providers, and vendors, to understand where investments in automation and machine learning will deliver the greatest ROI to patients and the care team. Previously, I spent many years at the advisory board studying best practices in clinical operations and hospital physician alignment strategy, as well as at E&Y. I joined Notable just this past year. Here I share with you the agenda. First, we have 4 parts today. First, we're going to cover the data, and if you will, and the urgency that exists in the market for intelligent automation in a section called Healthcare is in Crisis. Second, we will review findings from our State of Automation report, which showcases the challenges that the care team is facing regarding the pace and nature of work that they do. Third section is devoted to insights from our efforts automating the front end of healthcare, the things that we've learned. And fourth, I'll share with you just some best practices that we have learned from working with our customers and that we hope you will consider as you pursue intelligent automation in your own organization. Healthcare is in crisis. We have learned of late that it is no longer recession-proof, and health systems are facing financial crisis due to depressed top-line revenues and unsustainable bottom line or cost growth. Many viewed the effort to digitize a paper-based world as a means to ease the administrative workflow burden and foster productivity, but technology design, siloed information systems, and a lack of interoperability have created a scenario where technology has added administrative workload across the enterprise. That administrative workload is a burden, and it is driving dissatisfaction. This is an industry wholly reliant on talent, yet we have a crisis where talent is leaving the profession at a rapid rate. Burnout has reached epic proportions. 92% of healthcare organizations report a significant issue with staff burnout. It's driving a professional exodus not seen before. Retirements, departures, and an inadequate training pipeline are pushing labor markets to predict a shortfall of 3.2 million healthcare workers by 2026. 65% of organizations report higher turnover than in early 2020, and the volume of resignations over just the last 2 years has grown 50%. Healthcare margins have always been tight, but 2020 is tracking to be the worst year in quite some time. Anecdotally, we've seen double-digit negative operating margins, with a number of hospitals facing insolvency. While there has been some improvement across the last summer, the Kaufman Hall Index is still tracking negative. The driving forces are listed here on the right. The anticipated procedural demand has yet to rebound to pre-pandemic levels, driven in large part by the economy, but also by the continuing migration of volumes to cheaper ambulatory surgery center settings. Lower margin medical patients are staying longer due to lack of appropriate discharge locations and, frankly, lack of staff to keep those beds available, and unsustainable cost growth, due in large part to supply chain and talent shortages. We double-click here on labor costs. Health systems are paying $24 billion more per year for labor than prior to the pandemic. Much of that cost is driven by contract labor. A hopeful sign, however, is that its use has stabilized and may be declining. But that said, labor cost growth, while it has slowed, still continues apace, with inflation at a 40-year high. Labor costs are now more than 40% of total health system expense. Beyond inflation, the rapid escalation of wages is due in large part to competition for talent. Post-pandemic, the sector exodus continues, with the top reasons driving departure listed as better opportunities, better pay, or time off packages, and burnout. Every industry faces compensation adjustments, and perhaps healthcare has been long overdue, but the burnout is real as well. Care team members uniformly complain about how much time they spend doing non-patient facing work. We need to accept the fact that legacy tech has only complicated the nature of clinical practice. And in fact, to many, the EHR is an enormous workflow burden, compromising care team satisfaction. Surveys routinely report that clinicians spend more time looking at screens than they do communicating with patients, and it's a frustration on both sides. A recent class report found a strong correlation between EHR dissatisfaction and clinician burnout and departure. Clinicians charting after hours are more likely to report burnout. Clinicians dissatisfied with the EHR are more than 3 times likely to leave. And then note the quote on the right from the open responses that we received in our survey. Quote, the amount of digital paperwork we are required to do is constantly increasing. It takes us away from being at the bedside with the patient. Health systems have tried to remedy the patient digital experience by investing in point solutions, but these do little to really address the clinician experience and usually collect data that end up in work queues for administrative staff downstream. In fact, look deeper at physician burnout drivers, and you see they center around the nature of work day to day. Physicians spend too much time on administrative activities they were not trained to do. Physicians working at a pace that is unrelenting and entirely out of their control. And then limited time left for patients that what little time is left feels transactional and without meaning. And we are hearing reports that clinical staff worry about the implications of burnout on the quality of care they are providing. Here, I share just a few comments that came from the open-ended responses in our survey, and they are alarming. On the left-hand side, you can see the decrease in the quality of work. Quote, the burnout really makes you lose focus and interest in the work, no matter the complexity of the task. In the center, quote, had the admission assessment been done in a timely manner when the day shift wasn't so busy with an insane amount of required paperwork, the DKA would have been noted and treated immediately and not 8 hours later, end quote. And then right, obstacles exist in the technology itself, as I've already mentioned. Quote, my charting took forever due to the way it is formatted, and it seemed like I was repeating myself over and over. I think it could be simplified. So we wanted to get a deeper understanding about what is driving this level of burnout and dissatisfaction, and whether workers had any reasons for optimism that it would get better. So here's the methodology we undertook for our survey. We conducted a survey of over 1,000 healthcare professionals across frontline staff, healthcare executives, physicians, and other ancillary staff. We only included respondents that worked at an organization with 50 or more employees. And as it says here, the poll was conducted from March 3rd through 5th of 2022. A quick summary of our findings here. Point simply taken, workflow is ripe for automation. The care team, administrative and clinical staff are profoundly dissatisfied and burned out, burdened by redundant tasks that are more data entry than care delivery. In open-ended responses, mentions of being short-staffed or understaffed occur at least 139 times in 510 responses. That's 27% of responses, not including additional references to being overworked. On the right, you can see 57% of respondents are worried they will burn out to the high volume of repetitive tasks as they complete. Next, not surprising, and we are hopeful, glad they are hopeful that technology will help. Well, the progress has been slow in healthcare. What we see they all realize is that in the palm of their hands, tech has so much to offer them. 81%, in fact, feel hopeful that technology can help improve their experience as healthcare providers. And then finally, the time for automation is now. The work volume has outpaced current staff roles. The pipeline is insufficient to generate enough talent fast enough. And you can see it in the data, 48% of respondents are worried about their organization's ability to hire or retrain staff without automation. Gen X, millennials, and Gen Z all worry about burnout, and that is more than 80% of the workforce today, and frankly, 100% of our future workforce, so we cannot ignore these sentiments. There are multiple causes to burnout, but based on what we have seen and our survey, we have found that the nature of work and the repetitive tasks are a major contributor. You can see here, 57.5% of staff time at their organization is spent on repetitive tasks such as data entry. 57% of respondents also worry that they will personally burn out due to the number of repetitive tasks they have to complete. And then 28% of respondents have already quit a healthcare job due to burnout. Next, really Byzantine healthcare workflows are having a negative impact on patient care. The increased complexity and volume of work is overwhelming the care team right now, and they worry about its impact on patient care quality. You can see here 54% of respondents believe that the complexity of our healthcare workflows has a negative impact on patient care. Care team members in direct patient care roles are 5% more likely than non-clinical staff to think that healthcare complexity is harmful to patient care. And 45% of our respondents express frustration with how little time is being spent on patient care. Yet there's hope. Again, as I already said, these workers see in the palm of their hands all that technology can do and are ready for us to bring that same kind of intelligent automation to healthcare. You can see here the data, 81% are hopeful the technology can improve their experiences as healthcare professionals. 52% of respondents report a reduction in their workload due to technology, but honestly, patient-facing staff are less likely to say technology has helped given the workload that they face with the EHR. And then 48% are worried about their organization's ability to retain and hire staff if their organization does not prioritize automation. There are countless staffing challenges ahead, but much of the work to be done is in the health system's control. This is about bringing joy back to healthcare delivery by taking the routine, redundant administrative tasks that exist and moving them out of the care team's way. It is work that is perfect for automation. Let digital assistants or lines of code, if you will, take this on. Your bank has figured this out. So too has Amazon and Shopify and Zappos. We are figuring this out for health systems. And here are our recommendations as you start this journey. First, keep your strategic priority, the patient, at the center of what you do. Don't optimize for the department or the specialty. Optimize for the patient outcome. Then the engagement and the volumes will follow. When you invest in technology, think holistically about what that means for how you engage with the patient and how you bring that data into your system of record, which is the electronic health record. Second, study the implications of any investment you make on the care team. Solutions that check a box on your most wired list may very well not solve any problems and have terrible implications for workflow downstream. Case in point, just because you scan an insurance card, if someone is in the back office and they have to key in that data manually, the outcome is poor. That is not automation. It is just creating a PDF. Third, expect that change will take time and that you must work to rebuild trust. The care team has been burned by digital transformation to date. They rightfully harbor cynicism and skepticism about technology and its benefit to them. Technology implementation needs to start before you sign any contract. Bring your care team into any purchasing decision and earn their support. They will embrace automation when they see what's in it for them. For this last section, I'd like to share best practices we have learned from working with customers. insights on what is moving the dial for them as they use intelligent automation to transform the nature of patient intake and front-end revenue capture at their organizations. First, deliver consumer-grade experiences. We engage with Amazon and our bank because they use these principles. Let's bring them to healthcare. First, know me. Create a personalized digital experience that will engage and delight patients with the goals of having them complete activities while in their home. They can pre-register, fill out a clinical form or patient history, take a picture of their insurance card, register for a flu shot, pay a copay before they get to your office. Nearly 1.5 million patients at Intermountain Healthcare used Notable last year to pre-register for visits. Second, remember me. Use that information to make that digital experience better every time. This is the power of machine learning and automation. Make data capture efficient for patients and staff and feed that data directly into the EHR. Every time a patient at Intermountain pre-registers, it saves their staff 4 minutes. That rolls up to nearly 59 support staff FTE saved over a year. Value me is last. Anticipate my healthcare needs. Using Notable, another one of our customers, Lowell Community Health Center in Massachusetts, is automating and customizing communications based on social determinants of health, such as language and literacy. And they are identifying eligible patients and connecting with them in their preferred language about when and where to receive care, and frankly, screening updates. We can send messages and engage patients there using English, Spanish, Portuguese, and Khmer. It has profoundly changed the way this federally qualified health center communicates and has empowered their patients to own their appointments, their tests, and even their wellness screenings. Ease scheduling complexity for all, and a couple of points to share here. First, online scheduling has been around for some time, yet it has not always gone well. It is a complicated process and it requires enormous change management to get it right, including a deep understanding of provider scheduling preferences, clinical expertise, diagnostic requirements for specialties and subspecialties, and how patients search clinical information. This is hard. You have to build trust. This is not hire a vendor and plug and play. You spend a lot of time building those scheduling decision trees. Well, you want to work with a company that has the clinical and technical expertise to study and rebuild them digitally, starting with primary care and straightforward diagnostic specialties. We recommend starting with outbound or ticket-based scheduling, where you can use digital assistants to engage a list of patients for just one specialty and even one doctor. Build results from there and then slowly add physicians and specialties over time. Last, solve for patients, providers, and staff. We all spend far too much time looking at screens and not connecting with one another. Automation has the potential to allow humans to interact with humans and let technology take care of the documentation. We want to put routine, predictable tasks in the hands of digital assistants who then reach out to patients and collect data in advance of their planned visit while they are in their homes. When you get this work completed upstream before the patient arrives, you reduce patient time spent in waiting rooms, completing clipboards and pulling out insurance cards, and then staff time looking for those cards when those cards get dropped in the crack behind the computer screen, plus asking for credit cards and payment, which none of the staff like to do. This is not why your support staff chose this job. They want to help people. They want to answer questions. They want to make them feel comfortable. And the patients, they don't want to rush through these forms while they stop their kid from tearing up the People magazine. They want time to focus and do this stuff right at home in their PJs. When you move these tasks out of the waiting room, you free time for the care team, the support and clinical members to have meaningful interactions with patients. Across the bottom, you see the time savings enjoyed per provider at just one of our customers, Austin Regional Clinic in Texas. Roll up the number of visits you complete, or roll up the number of patients, I should say, who complete a digital intake experience before their visit. And you can see what that equates to in hours saved across the bottom. On the left, savings due to digital clinical intake. This is time saved for medical assistants and nurses asking questions either over the phone ahead of procedures or in the room during your visit as you are ready for the physician or the advanced practice nurse that you're going to see. And then to the right of that, savings for patient registration, copay collection, and appointment reminders. These are time savings for patient service specialists at the front desk. All told, our customers are reporting dramatic savings in time spent in the EHR and giving Notable a tremendous thumbs up at the same time. You can see our Net Promoter Score there at the lower right. Visit our website at notablehealth.com to learn more. Thanks so much for your time today.